Hi, everyone. This is Karen Yaboa Norman, nurse practitioner for roles for MPs. Today on Highlighting the MP, I'm going to learn more about the nurse anesthetist role. When I started my career as a registered nurse, and I was thinking about what my advanced degree in nursing to be in, I was in between nurse practitioner and nurse anesthetist. And I know with nurse anesthetist, I needed about 2 years of ICU experience, which I did not have. So I went with the nurse practitioner route. So today I have my Duquesne University colleague, Katy Palma, who is a certified nurse anesthetist, and she's going to tell me about what being a nurse anesthetist is like. I'm excited to have this talk with her. Thank you, Katy, for joining us today.
My pleasure.
I'm so glad. I'm so excited for this conversation. So what made you decide to go back for Certified Registered Nurse Anesthetist?
So I knew I wanted to have an advanced nursing degree, and I wasn't quite sure what I wanted it to be in. But when I was in undergrad nursing with you, actually, I had to undergo an endoscopy, and I had a nurse anesthetist doing my anesthesia. I was really, really nervous, but she was so good at comforting me and making me feel safe that I decided that's the career path I wanted to take.
That's funny you say that, because I had an endoscopy in 2016 and I had a nurse anesthetist as well, and she was great. Nurses just have a healing touch. So we have a shared experience. Can you tell me how nurse anesthetist school was like? How was it?
It was very grueling. Definitely don't want to sugarcoat that. Very intense. I would say you would have about like an inch thick of information on PowerPoint slides every week that you had to memorize and then be tested on the following week. And then in addition to that, you were at clinicals 4 days a week. So I didn't really have much time for anything else except for Saturday night would be my husband and mine date night. And that's kind of what I used to look forward to each week to get me through the program.
So basically, in nurse anesthetist school, you had 1 day of didactic and then like 4 days of clinical.
Yes. So at the beginning, the first semester was 5 days of didactic, and then after that, the rest of the semesters were 1 day didactic and 4 days clinical.
Okay. Were you able to work at all when you were in school?
No, definitely not.
I see. Okay. And how was the board exam?
It was tough. I studied for I feel like my program did a very good job at preparing me for it. But in addition to that, I studied for about 8 hours a day, 10 days in a row after graduation. And then I went for it, and it was tough, but I passed my first time.
That's great. That's great. Wow. So you studied 8 hours a day for 10 days and you took it.
Yes.
That's great. You were always a smart one at Duquesne. How long have you been a nurse anesthetist?
I graduated in 2018, so it's been a little over 4 years now.
Okay. And what's your daily schedule like working as a nurse anesthetist?
My current facility, I do 3 12-hour shifts, which is 7 to 7. And then on the 4th week of the month, I do 4 12-hour shifts. And that way it essentially makes it an average of 40 hours a week for the whole month.
Okay. All right. That's not bad. What's a typical day like as a nurse anesthetist? Like, how many cases do you do a day?
So that kind of depends on the assignment they have you for. I've been in cases where you're doing a really, really intense brain tumor that literally takes the entire day, and you just have that one case. And then I've also been assigned to GI, where you can do maybe like 10 cases, 12 cases in a day on your feet, really, really quick pace. So it just depends on your assignment.
And what are your other duties? You said that you do like epidurals, A-lines. Can you elaborate on that?
Yeah, so we do epidurals for the L&D department, which is, I think, really fun because that's the happy side of the hospital. I also place spinal blocks for people that are having like a knee replacement or a hip replacement. And of course, I intubate, place people under general anesthesia. I'll do arterial lines if it's a more extensive surgery or if somebody is really sick and needs closer cardiac monitoring.
Nice. So it's a well-rounded career. You guys monitor, you guys insert stuff. Pretty cool. So it sounds like it's never boring.
Definitely never boring. You're always learning something new every day.
Nice. And do you have to work holidays or weekends at all?
Not at my current facility. At the last hospital I worked, I had to work two holidays a year. And then I had to do a Saturday 24-hour shift every 5 weeks, which got to be a little bit grueling.
Nice. So it's good that you don't have to work holidays anymore. You don't have to be tied down on a weekend. That's good. Okay. So it just depends on the facility you work at.
Yes.
Yeah. Okay. What has been your most memorable patient case as a nurse anesthetist?
I don't know about any one particular case, but things that really stick with me or like types of cases would be seeing really young people with brain tumors because that can stick with you and be really sad. But then on the opposite end of that spectrum would be doing C-sections. Those seeing the mom and dad like cry happy tears and like a brand new baby cry, like it's really quite magical. And knowing that you're the one that like kept the mom in comfort the whole time as well is also just really, really gratifying.
So if I become pregnant, should I get an epidural? Because I've talked to a lot of my colleagues and they're like, I just did it natural. So what advice would you give me about an epidural for labor?
I say if I'm pregnant, the minute I walk in that hospital, I'm asking for an epidural. In my experience, a lot of moms who have tried to do it natural, and don't get me wrong, there's a lot that can do it natural, but I've seen many people regret it and they ask for the epidural when they're a little too far dilated, which we attempt to put one in, but at that point they're in so much pain, they're moving around a lot. It's kind of like a moving target when you have a needle in somebody's spine, which can also be scary. It can be really difficult to place the epidural if you wait too long. So I would say get it so that you don't have any regrets.
Okay, thank you. Thank you for that.
Yeah.
What are the pros and cons of your career?
Pros and cons. So pros, I just think anesthesia is so cool. That's me personally, but it's quite amazing to have somebody's entire stomach opened with a surgeon, working on organs, but because of you, because of me, I have the patient doesn't know, their brain doesn't even know, they're completely asleep. You're monitoring them, keeping them comfortable. In addition to that, having a greater skill set, advanced skills such as, like we talked about the intubating, replacing A-lines, epidurals, and then also just having more autonomy in our profession.
Those are great advantages. And then what would you say are the cons? Because every job or career has cons. What would you say are the
I would say it can be pretty tough to find a facility where you have a good schedule. Thankfully, I'm very lucky, and my current facility has a great schedule with the 312s. But a lot of places require night shifts and holidays, weekends, and like I had previously done, the 24-hour shifts, which can be tough. Another con is that if you're working in an anesthesia team model and you have a supervising physician that wants to do something one way and you know, you don't really agree with it, but as long as it's technically safe for the patient, you know, you have to go with what they say, which doesn't happen a lot, but it still sometimes happens.
Okay, good to know. Thanks for sharing. And in 5 years, what do you visualize your career to be like as a nurse anesthetist?
Well, I recently became clinical coordinator at my facility in addition to being a full-time staff CRNA.
Right.
Um, yeah. So I'm still pretty new at that role and learning how to navigate it. But in 5 years, I'd really like to expand on the student nurse anesthetist program that we have at my facility. So maybe having things like having them present some journal articles or having more learning opportunities at our clinical site, more maybe like meetings and just overall improving on the student nurse anesthetist learning abilities at our site.
Yeah, that's amazing. Just, giving back to the next generation of nurse anesthetists. Any type of learning is helpful in growing as a nurse anesthetist. So, okay, pretty cool. Um, Thank you so much for joining us today on highlighting the MP. I learned more about this role. Thank you for sharing your experience.
No problem. It was so great touching base with you again.
I know. We got to keep up. Thank you. Thank you so much.
Absolutely.